Hi, Dr. Michael DiMattina, Medical Director at Dominion Fertility. So what do you do if you have RIF, recurrent implantation failure? Well, there are lots of things that we can do to prevent it right off the bat. At Dominion Fertility, we only transfer the embryos frozen thaw. We don't transfer fresh embryos because we know, and this has been shown now for over a decade, that freezing the embryo and transferring it outside of the stimulated cycle results in higher pregnancy rates. So we never transfer our embryos fresh. We get higher pregnancy rates when they're frozen thawed and transferred outside the stimulation cycle. What else can we do? Well, we also do PGT, pre-implantation genetic diagnosis. The most common cause for implantation failure, or one of them anyways, is that the embryo is genetically abnormal. I remember I had a patient who was 28 years of age. He had 8 embryos. We did PGT on him. Only 1 embryo out of 8 was genetically normal. Much lower than we would expect, but had I not done PGT, she could have potentially gone through 8 transfers before she got pregnant. Instead, we knew exactly where to go. We put that 1 normal embryo into her and she had a baby. What do you do, Alice, if you still have recurrent implantation failure? Well, we have things called endometrial receptivity assay now. What is that? Basically, we take the patient and we set her up as if we're going through an embryo transfer process. But on the day of the embryo transfer, we don't transfer the embryo. Instead, we do a little biopsy up into her uterus. In the office, no surgery. We send the tissue to be examined to see whether or not the endometrium is receptive or pre-receptive or post-receptive. Now, 80% of women are receptive, so they probably don't need the test, but we don't know who those 20% are. So if we have a patient who has recurrent implantation failures, we're putting the embryos in, they're genetically normal, they're frozen thawed, but she's still not getting pregnant. Why? We do the ERA. There is some debate about the validation or the worthiness of ERA. In my eyes, in my opinion, it has a definite place in reproductive medicine. There are other things that go along with that. We can now check the endometrial cavity for abnormal bacteria. It's called EMA by a company we work with called iGenomics. And in fact, we were one of the first in the world to do that. We published a study last January about EMA, looking at the microbiota, the endometrial flora, to see if there were good bacteria and bad bacteria. Cutting edge stuff. So if you have RIF, recurrent implantation failure, you're probably devastated. Well, there are things that can be done. That's what I'm trying to say. So, Dr. DiMattina, Dominion Fertility. Hope that helps.
Dominion Fertility, making miracles happen, one family at a time.